Hi guys, Don here. I want to go over a little bit about our last group session. We had it on a couple of days ago, and we talked about the protocols for plantar fasciitis and some of the feedback I got from those that were at this group session. One was that the time was a little bit hard at noon Eastern Standard Time for people to come, so we're going to switch it for the future to 12:30. The next one we're actually going to be doing is on how to do a 3-minute newsletter. So stay tuned for that for the month of April. But if you guys want to watch the whole group session, you can just get the recording. Go to podiatrypracticemastery.com, and then you can just register and you can get access to all these previous group sessions. But this one we talked a little bit about treatment protocols for plantar fasciitis, and some of the comments I got were it went a little bit too deep and it went a little bit too fast because of all the technology aspects. I want to keep it real simple. What we talked about basically. We talked about how the idea of protocols came to being, how I kind of started to use them. A lot of this came from work with the American Academy of Podiatry Practice Management and these other groups that we were involved in, where we talk about how to use different protocols. And I went into some of the specific protocols that make treating these conditions, whether it be plantar fasciitis or other ones, a lot simpler. And we talked about the treatment stages, kind of the before, the during, and the visit, and after the visit, and breaking it up. And then we broke up the actual visit into visit categories, where we talked about patient interaction, we talked about imaging, different procedures, prescriptions, durable medical equipment, in-office dispensing, referrals, and patient education resources. And I went into each of these in detail, and it worked pretty well. I think there was a lot to cover. And so I feel like we may have to answer or field some questions later on, or if there's enough interest, we may make a whole other kind of course just on plantar fasciitis. But the bulk of the time then was you taking each of those things and you throw them into this checklist. And that's where kind of the most important aspect of this is how to use the plantar fasciitis checklist. So I showed the actual checklist, and on that it's basically the same thing as I just talked about above, but my checklist, it has like the imaging aspects, x-rays, ultrasound, MRI, the traditional treatments, which including like shockwave and amnio, which to heal and repair it, and then to reduce pain like cortisone, anti-inflammatories, icing, and then some of the physical therapy modalities to reduce the tightness, and then how to kind of implement orthotics with that. The checklist is really the most important thing, I think, of the whole talk. And if you want to, you can kind of listen to it and you can learn more about getting that and watch the video and look at the checklist there. And then I went over a little bit about how to package this, and that's something that's kind of new to all of us, is how you can kind of package this into certain price ranges and things like that. So I hope you'll enjoy the group session. If you want to learn more about it, if you guys want me to answer or explain any other questions in further detail, let me know. Or if you want to talk about it, you can certainly once you register to be member there of this membership thing on Podiatry Practice Mastery, you could set up a strategy session with me to ask any questions you may have, or just email me asking any questions. Okay, that'll make fodder for the future podcast episodes. Okay, guys, have a great day, and thank you so much. Okay, bye-bye.